Assalamualaikum warahmatullahi wabarakatuh. We are from the group 1. Today we are going to present about HIV infection and AIDS. So let's get started. So our group members consist of three people, which is me, Sarah Inani binti Saiful Azwam. My metric number is 081189, and the next group member is Nur Suhaili Amani binti Muhammad Sukri, and her metric number is 075420. And the last group member is Wan Nur Idayu binti Wan Aziz, and her metric number is 079803. So we are going to see the definition and meaning of HIV infection and AIDS. So for the first one is HIV infection. It means human immunodeficiency virus. HIV infection is a viral infection that attacks and weakens the immune system by targeting CD4 cells, making it harder for the body to fight infection. So for the next one is AIDS. It means acquired immunodeficiency syndrome. AIDS is the most advanced stage of HIV infection, marked by severe immune suppression, a CD4 count below 200 cells per millimeter, or the presence of opportunistic infection. Next slide is about the prevalence of HIV infection and AIDS. As of 2024, an estimate 40.8 million people were living with HIV worldwide. The global adult HIV prevalence among individuals aged 15 to 49 years was approximately 7.0%. Since the beginning of the epidemic, about 88.4 million people have been infected with HIV, and approximately 42.3 million people have died from AIDS-related illnesses. In 2023, there were about 630,000 deaths due to AIDS-related diseases globally. In Malaysia, HIV remains a major public health issue despite steady progress in prevention and treatment. By the end of 2022, it was estimated that approximately 86,142 people living with HIV in the country, with an adult prevalence rate of about 0.3% among individuals aged 15 to 49 years. The epidemic is largely concentrated among key populations such as men who have sex with men, people who inject drugs, female sex workers, and transgender individuals, who continue to show higher rates of infection compared to the general population. The pathophysiological of HIV infection and AIDS. Firstly, entry and infection. The virus enters the body through contact with infected blood, semen, vaginal fluids, or breast milk. It binds to the CD4 receptor and a co-receptor, which is CCR5 or CHCR4 on the surface of the helper cells. Secondly, replication. Once inside the cell, the virus releases its RNA and uses the enzyme reverse transcriptase to convert RNA into DNA. This viral DNA is then integrated into the host genetic material with the help of integrase enzyme. Thirdly, viral production. The infected cell begins producing new viral particles using its own machinery. These new viruses bud off and infect other CD4 cells, continuing the cycle. Uh, for the next one is immune system damage. Over time, the continuous destruction of CD4 cells leads to immunodeficiency. The body becomes increasingly unable to fight off infectious and certain cancers. And lastly, progression to AIDS. When the CD4 T cell count drop below 200 cells per millimeter, or when opportunistic infections like tuberculosis, pneumocystis pneumonia, or candidiasis develop, the condition progresses to AIDS, acquired immunodeficiency syndrome, the final and most severe stage of HIV infection. The clinical manifestation of HIV and AIDS. Firstly, acute HIV infection, which takes 2 to 4 weeks after exposure. During this initial stage, the viral multiplies rapidly and flu-like symptoms appear as the immune system responds to the infection. The common symptoms are fever, sore throat, rash, muscle and joint pain, fatigue, headache, swelling lymph nodes. These symptoms usually last for a few weeks and may be mistaken for common viral infection. Secondly, clinical latency, which is chronic HIV infection. This stage can last for several years. The virus is still active but reproduces at very low levels. Many people may not show symptoms. The possible symptoms are mild lymph node enlargement, which is persistent generalized lymphadenopathy, fatigue, mild weight loss. Without treatment, the infection slowly damages the immune system. The third clinical manifestation is acquired immunodeficiency syndrome, which is AIDS. This is the most advanced stage of HIV infection, marked by severe immune suppression. The major clinical manifestations include severe weight loss, which is HIV wasting syndrome, chronic diarrhea, persistent fever, recurrent respiratory infection such as tuberculosis, pneumonia, oral thrush, which is candidiasis, skin lesions like Kaposi's sarcoma, and lastly, neurological complication such as HIV encephalopathy, confusion, and memory loss. AIDS is diagnosed when CD4 cell count below 200 cells per millimeter or when opportunistic infections or cancers develop.
Management for HIV infection, we have three, which is medical, surgical, and pharmacological. So for medical, firstly is regular checkup. For example, monitor viral load, which is amount of HIV in blood, and CD4 count, immune strength. Second is vaccination, such as protect against infection like flu, pneumonia, and hepatitis. Third is nutrition and lifestyle. For example, healthy diet, exercise, avoiding smoking alcohol. And the last one is preventing opportunistic infection, which is use preventive medication if immune system is very weak. And next is surgical. First is abscess drainage. If an HIV patient develops abscess due to infection, next is biopsies to diagnose suspicious lumps or cancers like Kaposi sarcoma. And the third one is repair of complication, for instance, bowel obstruction or severe infection that need surgical intervention. And for pharmacological, first is nucleoside reverse, which is transcriptase inhibitors and RTIs. For example, tenofovir, zidovudine stop the virus from copying itself. Second is non-nucleoside reverse. uh, which is transcriptase inhibitors, and then RTI. For example, efavirenz, nevirapine also block viral replication, but in a slightly different way. And the last one is protease inhibitors, PIs, such as lopinavir, atazanavir, prevent virus from maturing and infecting new cells. So next is management for AIDS. We also have three, which is medical, surgical, and pharmacological. So for medical, firstly is regular monitoring, such as viral load, CD4 count, and screening for opportunistic infections like TB, pneumocystis pneumonia. Second is prevent infection, for example, vaccines, where safe and prophylactic antibiotic antifungal. And the third one is nutrition and lifestyle, such as high protein diet, avoid alcohol and smoking. For surgical, firstly is abscess drainage, uh, for example, skin or internal infection. Second is biopsy of suspicious lesion, for example, Kaposi sarcoma, lymphoma. And the third one is surgery for severe infection or organ damage, such as intestinal obstruction, necrotic tissue. And the last one is pharmacological. First is anti-HIV medicine, which is R, fight the virus. For the goal, stop HIV from multiplying and keep the immune system strong, such as NRTI, which is block HIV from copying itself, and NRTI also block HIV copying. Second is medicine of infection, opportunistic infection for fight germs, and cartimozole prevent pneumonia and toxoplasmosis. And the last one is fluconazole treat fungal infection. Possible complication for HIV infection. First is frequent infection. The person may get common infection more often, like colds, flu, or skin infection. This infection may last longer and be harder to treat. And secondly is weight loss and tiredness. The body use more energy fighting the virus, so people often feel weak, tired, and may lose weight. And the third one is swollen lymph nodes. Glands in the neck, armpits, or groin may swell for a long time. And next is AIDS. Firstly is opportunistic infection, such as tuberculosis, TB, pneumonia, especially pneumocystis pneumonia. Secondly is certain cancer, such as lymphoma, which is cancer of the immune cell, cervical cancer in women. And the last one is brain and nerve problem, which is memory loss and confusion.
So, for the next slide is health education. The first point is take your medicine every day. You must take your antiretroviral therapy exactly as prescribed. Do not skip or stop on your own. Taking your medicine regularly helps control the virus, keeps your immune system strong, and prevent you from getting sick easily. The next one is prevent spreading the virus to other. Always practice safe sex by using condom. Do not share needles, razor, or toothbrushes. If you are pregnant or planning to have a baby, talk to your doctor yearly to prevent passing HIV to your child. The third one is eat a healthy and balanced diet. Good nutrition helps your body stay strong and fight infection. Eat fruits, vegetables, protein like fish, egg, and beans, and drink plenty of water to avoid too much alcohol and stop smoking, as this can weaken your body immune. So the last one is take care of your mental and emotional health. Living with HIV can be stressful, but you are not alone. Talk to your healthcare team, counselor, or support group if you feel sad or worried. Having emotional support helps you to stay positive and live a healthy and happy life. So next one is nursing diagnosis 1. Imbalanced nutrient related to depressive symptom as evidenced by food intake less than recommend daily allowance. For goals, patient will report increased appetite and interest in food. Evaluation, patient show improved by increased food intake and improved mood and energy levels. For the nursing intervention, the first one is assess the patient's potential barriers to eating. The rationale is to determine the extent of nutritional deficit and identify foods the patient prefers or avoid. The second one is monitor weight, body mass index (BMI) and relevant lab values such as presence of albumin or hemoglobin. The rationale is to evaluate the patient's nutritional status and detect any changes early. The third one is encourage the patient for eating small, frequent, and nutrient-dense meals. For the rationale is smaller portions are less overwhelming and easier to tolerate for patients with poor appetite. And the next one is provide a quiet, pleasant, and well-ventilated eating environment. A calm setting can improve appetite and make me time more enjoyable. For the five for the next is involve the patient in planning meals and selecting preferred foods when possible. Giving the patient control and choice can increase interest in eating and support autonomy, which help with depression. And the last one is encourage social interaction during meals, such as eating with family or group, either friends. Social support and companionship can reduce feeling of isolation and stimulate appetite. For the next nursing diagnosis is risk for infection related to immune suppression and opportunistic infection. For the goals is the patient will remain free from infection as evidenced by normal body temperature, absence of sign of disease, and stable laboratory value. For evaluation, patient remain febrile, showed no sign of infection, and laboratory result remain within or close to normal limits. The first one is assess for sign and symptom of infection, such as fever, chills, cough, wounds, sore throat, and urinary changes. The rationale is early detection allows for prompt treatment and prevent complications. For the second one is monitor vital sign of the patient and laboratory results include white blood cell count, CD4 count, and viral load. For the rationale is abnormal values may indicate infection or declining immune function. Next, maintain strict hand hygiene of the patient before and after patient contact. The rationale is hand washing is the most effective way to prevent the spread of infection. For the fourth is encourage the patient for proper personal hygiene and skincare. Clean skin and mucous membrane help reduce the entry of pathogens. The next one is educate the patient to avoid contact with sick individuals and crowded places. Exposure to infection agents increases the risk of acquiring infection. For the last one is administer prescribed prophylactic medication and monitor for side effect. Prophylactic antibiotic or antiviral help prevent infection common in immunocompromised patients.
Assalamualaikum, kami daripada grup 1 iaitu topik HIV infection and AIDS. Saya Wan Nur Idayu binti Wan Aziz, nombor matrik 079803, memegang watak sebagai Aiman.
Nama saya Nur Suhaili Amani binti Muhammad Sukri, nombor matrik 075420, memegang watak sebagai Dr. Sofia.
Nama saya Sarah Inani binti Saiful Azwam, nombor matrik 081189, memegang watak sebagai Mira.
So, happy watching guys.
Ya, macam mana kelas ni? Okey tak?
Okey, macam biasa.
Ya. You nak tahu tak? Semua kawan-kawan I, Haziq, Alif, semua dah bebas. Diorang cakap
Kalau kita saling cinta, saling percaya, kita boleh je nak buat apa yang kita suka.
Bebas macam mana tu? Jangan cakap bukan. Kita masih belajar tau. Masih muda.
Alah yang, dunia sekarang kan dah lain. Dunia moden ni yang. Tak salah pun. Lagipun ayah kan sayang baby.
Memanglah ayah saya baby. Tapi cinta bukan alasan untuk kita buat bukan. Kita ni masih muda. Kita menjadi mahu diri, mahu keluarga.
Alah, cicil lah yang. Awak ni suka sangat overthinking. Takkan benda kecil macam tu kau nak risau.
Baby, kadang-kadang benda kecil ni nak kalau baby kita. Kita kena betul-betul tau.
Alah yang, awak ni suka sangat lah overthinking. Takkan benda kecil macam tu pun awak nak risau.
Baby, kadang-kadang benda kecil macam tu lah yang boleh ubah semua hidup kita. So, kita kenalah fikir elok tau.
Yang, kenapa muka awak pucat sangat ni? Dah seminggu nampak tak sihat.
Dah early kan? Saya selalu rasa demam, tak larat. Kadang-kadang rasa nak muntah pun ada.
Mungkin sebab stres kot. Assignment banyak, kerja banyak kan?
Tak pastilah. Tapi kan, saya ada baca pasal HIV. Hampir semua gejala ada kat saya. Risaulah.
Yang, janganlah cakap macam tu. Takkanlah kita...
Saya pun tak pasti. Tapi, kita kena cari kebenaran. Kita kena pergi klinik untuk buat pemeriksaan kesihatan.
Okay, kalau macam tu nanti kita pergi sama-sama. Apa pun keputusan, saya janji saya tanggungjawab.
Mira, sudah dapat keputusan ujian awak. Saya harap awak bersabar untuk dengar keputusan dia. Kak.
Ya, doktor.
Keputusan ujian dah keluar dan awak positif HIV. Tapi jangan panik. HIV bukanlah hukuman mati.
Saya tak sangka semua ni berlaku sebabkan silap saya sendiri. Apa tu saya, doktor?
Salah saya, doktor. Saya yang paksa dia. Saya dah fikir panjang masa tu.
Saya tahu ini berat, tapi kamu berdua masih ada harapan. HIV boleh dikawal dengan rawatan tetap. Yang penting, ubah cara hidup, jangan ulang kesilapan yang sebelum ni.
Tapi doktor, kalau saya kembali kan tak kena bunuh.
Sudah tentu, ramai pesakit HIV di luar sana yang masih hidup bertahun-tahun dengan rawatan dan sokongan. Tapi tolong bantu orang lain untuk jangan sebarkan lagi virus HIV ini, ya.
InsyaAllah, saya janji doktor. Saya nak ubah diri. Saya nak jadi contoh, bukan pelaku.
Sebagai kesimpulannya, HIV bukanlah pengakhiran kehidupan, tetapi perputaran bebas boleh menjadi permulaan kepada sebuah penderitaan.
Kami pernah tersilap langkah, tetapi kami belajar yang erti cinta sebenar bukanlah sekadar tubuh, tetapi ianya membawa erti kesetiaan dan kejujuran.
Cegah sebelum parah. Buat pemeriksaan, belajar mengetahui cara-cara jangkitan dan jangan hukum mereka yang dijangkiti. Mereka perlukan kasih sayang, bukan penghinaan.
Hargai diri, hargai nyawa.
Setiap pilihan ada harganya. Pilihlah yang membangun hidup, bukan penyesalan.
Bye.
That is all from our group. Thank you.